Hi everybody, welcome to Kay's Corner. I'm your host, Threadmaster Kay, and today I'm going to be answering in depth some of the questions that I had put out to you last week in my Instagram post. So you know that I love Eat, Sleep, Breathe PDO Thread Lifts. There are many types of thread lifts that I'm sure you have been watching all over YouTube. We've got the ones from a PLLA, which is commonly known as InstaLift. Then there's PLACL, and you know that I love to do the PDO Thread Lift. The reason for that basically is I have the history that we have with PDO threads for hundreds of years. They dissolve beautifully under the skin. They're very easily accepted by the body, and so hence we have that safety profile for the patient that, number one, is it safe? Yes, it's extremely safe. So I've been able to use many different types of sutures, but I focus my practice mainly on PDO threads. I have used PLLA as well in certain patients, but we will talk about that a little later. There were some questions that you posed to me regarding thread lifts, and I'm going to pick a few of those and answer those today for this segment. So one of the big questions that seems to be coming back again and again is, if we have a thread lift or if we have many thread lifts, are we able to have plastic surgery later? I've had the comments, oh my goodness, I would never do threads because then I can never have plastic surgery. Well, I've actually posed this to some of my students who are in fact plastic surgeons themselves, right across all of North America down to Colombia and Venezuela. And the answer is absolutely, you can have a thread lift and have plastic surgery when and if you're ready for that. So who is the right candidate? The candidate is anybody who feels they've got descent and some droop, sag in their skin. It could be as early as in their mid-20s. You could be 25 to 30. You could be in your 30s. You could be in your 40s, which is primarily the group that does come to me. I find between 37 to about 55 is the group that will show up at my doorstep, will end up showing up on DMs in Instagram posts and asking whether they are a good candidate. So what makes a good candidate is just you. If you feel like you need to be refreshed, maybe you've had some augmentation, maybe you've had some fillers, dermal fillers, maybe when you first started off your facial augmentation, and they're just not giving you the type of results you're looking for, the PDO Thread Lift is definitely the next option for you. It is a very safe, a very comfortable procedure, even though some people say, oh my gosh, it looks so painful. We do use anesthesia, and the anesthesia does look after the discomfort part of it. Of course, who you go to, your provider, how much practice they have, that will also take into part the overall comfortability of your procedure. So let's go back to the question again about facial surgery and PDO thread lifts. If you're doing a thread lift and you start, let's say 37, 40 is kind of where I'm seeing people first start out, you're going to have a thread lift. If it's your initial procedure, you're going to get about 30% improvement in your overall facial experience. So it's not a 100% result. It is a 30% improvement. And with each treatment, depending on your age group and when you start, you're going to have possibly 1 to maybe 3 treatments to get the end result that you're looking for. How long does it last? So let's just use me for example. I'm 51 years old. I started doing threads on myself in the early 40s. I was probably 41, 42 when I first started doing threads on myself. At 51, almost 10 years later, I don't have any major sag, but I have lost some weight, I've had a tummy tuck, and all those things and aging, hormones, they make an effect on your skin. There'll be times when I'll want to have a little bit more work. There'll be times when I'll have a little less work. So I recently, in the last year, lost a fair bit of weight, and even I was looking at myself this morning, and I thought, okay, should I, do I feel a little bit more fresher if I do this? And I mean, you know what? In all actuality, I would tell a patient, you look amazing, you don't need to do anything. But because I have access to my threads and access to my students who can do this for me, I would like to do a little like this. So I don't know what you guys think, but I would like to do this. So what does that look like? So I would like to do a 1 vector lift in this area, and I'll be pretty happy with that. And then in the next 3-4 months, I may want to do another little vector. Now, it's not necessary that you do it all the time, meaning once you get your full facelift, I think once every 5 to 6 months, if you're over 40, come and see your provider. There may be 1 vector or 2 vectors. Maybe you want a little bit more chisel jaw. Maybe you want a little bit here in this area. Maybe you want it in this area. It really depends. It's so custom. And start your thread lift journey. Find a good provider. You will be eventually being able to go to my website and you'll have a list of people who I've already trained in North America. They're a Threadmaster K. They've gone through my training program and they are having continuing education. The other question is it painful? Okay, so I told you that there is anesthesia that I definitely use. It's usually about 2% lidocaine with or without epinephrine. That decreases a little bit of the extra bleeding that some people can have. The discomfort level in a consensus is between 3 and 4 out of 10. I would say that there's more pressure involved than there is pain. And once you had your first experience, you're not going to be really anxious about your second, third, or fourth, okay? So it's not really uncomfortable, but there is pressure. So once you've had it, you'll be fine with it. It's not a huge deal. If you're afraid of needles and if you're afraid of just generally any kind of procedure, that might be something you want to think about. But for PDO threads, if you've had fillers before, you'll be very comfortable getting a PDO thread lift. The next question is, how long does it last? Okay, if you're in your 30s and you get 1 procedure, usually in your 30s you only need about a 30% lift. You only have maybe about a 30% descent and sag. You can get 1 procedure and you're good for a year. And that generally can happen right throughout the 30s. Once you hit sort of if you continue from your 30s and you continue it, you may only need to have it once a year. And then maybe after your 40s, you may need to have it every 6 months just because you'll have different areas that need attention at different times. You could go through weight loss, weight gain, you could be sick, number of things can happen to you as we're going through life. So we address those changes as life goes on. But generally in the 30s, once a year is more than enough, and 1 treatment is enough. So if you come to me and you're 42, and you haven't done anything, you haven't had any kind of filler or anything, or any kind of their modalities, you're coming to me, I call bare skin, then generally depending on the percentage of sag, we'll assess it together. It's always custom. I find that in your 40s, you do need 1 procedure and then another one a month later once you've healed. And we'll take a look at the resistant areas. Sometimes people have resistant jowls. We'll raise them 30%, and a month later, we need to do another round to give it another level of lift. So I usually say 30% and then 60% a month later. If you want a 90% lift, you're going to come again in another month. When you're at 90% and you're in your 40s now, you've had a second or third procedure, from there, you're going to do maintenance. So maintenance is generally, it could be once a year if you want it. It could be every 8 months if you want it. It could be every 6 months if you want it. It really comes down to what do you want, what does your budget look like, and what do you and your provider decide together. Because like I said, I've been doing this for 10 years. I have no predominant sag, but there's vectors that I want to maybe give it a little bit of a lift, and I'll do those vectors. The next question I had on Instagram was, a lady went to a clinic, she had an assessment, the clinic said that she has too thin skin and that the sutures would show through her skin. Okay, so this is a twofold answer. If you have thin skin, or if you're really heavy tissued and you have heavier skin, those two are the more difficult clients to do. So the provider you choose is really important, and you might need to ask those questions is, have you ever had a thread lift? Have you done a thread lift on a patient that has thin skin? In the sutures that my company is selling, you have different thicknesses of sutures. So I don't believe that there is any reason why someone who has thin skin can't use threads or can't get a thread lift. I do procedures on thin-skinned clients all the time because they're the ones who have thin skin and sag. They're the ones who want that collagen induction from the side effect of PDO sutures, and they should be the candidate who you want to look after and give them a great lift. But yes, you do need to go to a proper provider. You need to have to talk to somebody who has experience in this area, that they've done a lot of thin faces, and then also the sutures they're using. So you're not going to use a suture that's going to show through the skin. So, you know, there's different thicknesses of sutures. There's different longevity of sutures within PDO sutures. And you need to go to someone who knows how to use the different gauges, as we say, or the different thicknesses for the right area. If you see someone using a pink suture, generally this is pretty standard across the industry. The pink end of the suture is an 18 gauge suture, is one of our thickest sutures. You can't use that on thin skin. So 100%, if that's the only suture you're using as a provider, then you can't use it. But if you have a variety of sutures, and that goes from 21 gauge, 20 gauge, 19 gauge to 18 gauge, there's definitely sutures within that you can use to give somebody with thin skin a very nice thread lift. Okay, let's see. The last one is, what if I'm on Ozempic? It's huge today. Everybody who's 40 and older or needs a little bit of weight loss situation is on Ozempic, and they are getting the side effect of Ozempic is, of course, it's weight loss. And then with the weight loss comes the Ozempic face, which basically means, you know, you're losing fat pads and you're losing fat from everywhere, but you are going to lose it off your face. And you are going to then need a more frequent thread lift. Okay, so if you're currently on Ozempic and you're losing weight and you're definitely seeing the weight come off your face, you may have to see your provider like every 2 or 3 months, because you really don't want to be on Ozempic or be on any of these medications. You lose your weight and your face falls, and then you're like, oh my gosh, I have to have a thread lift. Well, yes, you are going to have a thread lift, or you're going to have surgery, whatever you decide. But my advice is, as you're losing weight in your weight loss journey, please have a thread lift every 2 to 3 months so you stay up. So if I had a thread facelift and I maintain it, if I had a facelift, can I maintain it with a thread lift? Actually, in the next few episodes, you're going to be meeting one of my clients who went to South America. He's had a facelift and he looks great, but now he's having, again, some drooping is coming into place. There's some facial volume loss. He has lost some weight, and now we're going to be threads to maintain his facelift. So absolutely, nothing's permanent, everybody. So you're aging. So with aging, whether you have a facelift or a thread lift, there's going to be maintenance involved regardless. So I do recommend that you will have to maintain with threads or with other modalities. So I want to just quickly go back to the thread lift versus surgery question, which I didn't completely finish. So the amazing thing for plastic surgeons is there are a lot of people women and men in general, who definitely at some point when they can't just use fillers anymore, the filler starts to look like it's making them look like a marshmallow face. We're losing our contours of our face. It's a huge problem. And I find because we're starting younger and younger, I'm seeing more and more women now in their 20s getting filler than I remember when I was in my 20s doing this procedure for other people. When I first started in the industry about 30 years ago, there was just a handful of us. I was in London, Ontario, and there was just a handful of us providing aesthetic injectable services. And I remember the ladies, and I was about 27 years old, 27 years old, and I remember the ladies that came to me at that time were 40, 50 plus getting fillers. Now we see them younger and younger. So let's talk about that. If you're 25 to 27 and you just first got a little bit of filler on your cheekbone to give yourself a little cheek pop, now we'll push you forward and you're 40. At some point, the dermal fillers will not do the job of lifting your face or giving you a more contoured look. So that's where the threads come in. So that is why we need to add the thread lift with the filler combination, and that is going to give you a much more long-lasting and much more contoured look. So I really recommend that my providers use dermal fillers for where they're necessary, and then of course threads where they're necessary. And then now let's talk about the facelift. The people who are getting threads for like 10, 15 years, like I started when I was 40, I'm 51, I probably will continue to do my threads for as many years as I can, but at some point I'm going to want to have maybe just a lower facelift. I'll tell you that when I was 40, I probably would have never ever thought that I'll do a facelift. Like, oh my gosh, the downtime, the facelift, surgery, general anesthetic, all of those things. And I'm a provider. I don't think I was ready to even think about that. Now, doing threads for 10 years and enjoying a lifted type of face, I will 100% be going to have a lower facelift when I'm ready for it, or whatever I'll just go to the surgeon and say, whatever do you think I need, and have it done, because even after you get your facelift, you're going to still need to come back and maintain it with threads anyways. So it's a marriage of all these modalities, ladies and gentlemen. It is about having a little bit of filler when it's necessary. It's about having the threads where it's necessary to augment and give you those contours back so you don't lose the real shape. It's very, very natural. I don't think I can recall a single person who's come and either been trained by me or been as a patient with me and ever felt they look different really than when they first came in. I feel that you just look more refreshed version of yourself, and it's a 30% improvement. It's not 100%. So people say, am I gonna look plastic? Am I gonna look done? No, it's not surgery. It's not that harsh. It's actually a very soft, easy way of getting that lift, and you don't need to do multiple procedures if you don't want to. If you're happy with 30% and you're like 45 years old and you're happy with what I do, you're good with that. It's all good. See you again in 6 months or 9 months or a year. It's really up to you. I always say when you go in the mirror and you look at yourself and you do this and you say, oh my God, I wish I could have this, that's when you should come and see me or see any of my providers. So there was one question from I think was a provider about support, about training, that I will be addressing this more in my next video. So if you do love watching these, don't forget to hit the subscribe button, and that way you'll know that I've posted another video. It's not just always going to be about threads, but it's going to be about facial augmentation, health, beauty. Health is really important, guys. If you're not healthy, you can't even have a thread lift. So if you have a lot of immunocompromised issues, not that you can't have a thread lift. If you have, let's say, lupus or you're on certain medications, what happens is these medications, they will eat up your sutures faster. So why we love thread lifts is because they create a natural collagen underneath your skin. So as they dissolve, they leave organized scar tissue, and that gives you that nice firm glow thickness on your skin. If you're on some of these other medications, if you're a smoker, if you're a drinker, that's not just social, you will see that you'll have to do these procedures more often than not, and you will never really enjoy the actual result of the procedure because you'll never see the end product, because now either the nicotine is eating it up or the alcohol, that doesn't help any of those types of bad habits. Okay, so that's it for our show for today. I had so many amazing questions. Keep them coming, and in our next few episodes, we will be talking more about training, about Health Canada's approval, and what my company is doing to get us there. So take care. Again, don't forget to hit the subscribe button so you can see all of my videos. I hope that you are all beautiful, healthy, happy, and I can't wait to see you back next time.